Good afternoon, everyone. It's great to welcome you back to our IGTVs from Treehouse. Today we have a fantastic topic and we're going live with postpartum periods. Now that fall is upon us, we're very excited to meet Dr. Lesley Hawkins and speak about postpartum periods. So we're just going to wait for some individuals to join us and of course for our special guest to join us as well. Hi there, Dr. Hawkins. I see that you have. So I'm going to accept you and then we'll get going.
Hi, can you see me?
Hi, yes, I am. Hi, nice to meet you and nice to see you.
Good to meet you. How's it going?
Going well.
Good.
Hopefully your back to school transition has been good and you enjoyed the summer.
I did. Yeah. How about you?
Yeah, I'm happy. It was a good
Good.
summer, good weather, and now back to school and back to real life. So
Back to our routines, right?
yes, exactly.
Yeah.
So
Yeah.
let's get going. I'm going to start right
Sure.
away. We have some people joining us. Good afternoon to everyone that's joining us on the East Coast. We're back with our IGTV lives this fall, and today's special host we have Dr. Lesley Hawkins. And so we're discussing an important topic. It's called postpartum periods. I encourage everyone that joins us today to ask questions in the chat below and to really engage Dr. Hawkins as well over the next kind of 30 minutes that we discuss. So as some of you might know me, I see some familiar faces rolling in. My name is Julia Slenina. I'm the founder and CEO of Treehouse. At Treehouse, we've built technology that's really designed for practitioners from fertility all the way to early childhood to help and support their clients and really optimize their care journey. But part of the work that we do is also to work with experts in the field so that we can provide really fantastic content and educational information that is evidence-based and led by experts across Canada. And with that, today we have Dr. Lesley Hawkins, who is a Canadian board certified OBGYN working at the Humber River Hospital in the GTA. And she has a mission to equip people with reliable information about their health, from periods to pregnancy to menopause and more. So welcome, Dr. Hawkins. I'll let you introduce yourself briefly and then we'll jump right into the topic.
Thank you. Yeah. Well, as you said, I'm an OBGYN here in the Toronto area, River Hospital,
Oh,
and
she's
I'm a generalist, so I do everything from obstetrics, looking after people during pregnancy, to postpartum care, to gynecology and gynae surgery, and everything in between, menopause, teens with period issues, all that stuff. So I'm happy to be here. And I'll just make a disclaimer that our talk today is for educational purposes only. And certainly if you have any concerns about your health, you should seek care with your healthcare provider. And we can't answer any direct medical advice questions today, but happy to talk about this topic because it's a good one.
Absolutely. Thank you so much, and thank you for making that disclaimer. It's very important. So with that, let's get started with postpartum periods. So what should we expect? Let's talk about that first period after pregnancy. What if we've had a C-section? Very different than a vaginal natural birth. So I'll let you pick that off.
Sure, yeah. So the short answer is that it's hard to know what to expect. So just to reassure everyone that everyone's experience with postpartum periods is completely different. What we would expect medically is that after we deliver, whether it was a vaginal or a cesarean birth, that in the first 6 weeks postpartum, we can experience that postpartum bleeding, which we medically call sometimes lochia, which you may hear that term. And this is not a period, but rather it's your body recovering from the delivery. So from the time of delivery up to about 6 weeks postpartum, you could be bleeding every day. The flow of that bleeding could be up and down, just depending on the day. And for some birthing people, it may stop after 4 weeks postpartum. For others, it may last the entire 6 weeks. And once in a while, I see it last even longer than that. So that's the first part, is that we all experience that bleeding. Now, that's the same between vaginal birth and cesarean section. Anecdotally, I find that occasionally people who have had a cesarean section find that amount of bleeding is a little bit less. I don't have a good reason behind that, but for everybody, we can expect that bleeding in the first 6 weeks postpartum. And then after that's finished, the first period will come at some point. But for all of us, that is different. So it could come as soon as about 4 weeks after you have completed that bleeding, or it could stay away for up to a year or even more.
Okay.
And so everyone is completely different. And one of the biggest predictors of when it'll come back is whether a patient is breastfeeding.
Okay, so let's actually go into that, because that's one of my next questions, which is breastfeeding, and will it change my period? We know some folks really struggle, obviously, with pregnancy, with breastfeeding rather, in those early days as parents. But will it affect my period, and will a period affect the taste of that breast milk?
Good question.
Interesting question.
I don't think there's any evidence that I can find that it would affect the change in the taste in breast milk. So we don't have to worry about that, I don't think. Should not affect the baby's nutrition that they're getting from the breast milk. So that's reassuring.
Yes.
Periods while you're breastfeeding could be very irregular, or they could stay away. For a lot of people, if you're breastfeeding regularly, which we define as every 4 hours in the first 4 months postpartum, in those first 4 months, the period could completely stay away. And then for some people, it'll come back after that. For others, it won't. For their entire breastfeeding journey, they may not get a period at all. And it may not come back until after they've completed breastfeeding. While you're breastfeeding, if it does come back, say it comes back at 4 or 5 months postpartum, it may be very irregular and difficult to predict. And that is common and normal, because we're not ovulating regularly every month as we may have normally been while we're breastfeeding, because of the hormones of breastfeeding, which alter that.
Thank you. One of the other questions we have about periods is tampon use. Is it okay to use tampons after pregnancy? And let's talk about that again from a cesarean perspective as well as a natural birth.
Yeah, so I would recommend, no matter how your birth was, in the first 6 weeks postpartum, do not use a tampon. After that, once you've had your postpartum visit with your care provider, everything is going well, you can go ahead and use tampons for future periods. The reason why we ask you to avoid it is because we worry that there could maybe be an increased risk of infection going up from the outside up into the vagina and the uterus. So immediately postpartum, for 6 weeks, I suggest that you use pads. So stock up on pads if you're coming up to your delivery, because that'll be important.
Yeah, absolutely.
Yeah.
Is it normal, you mentioned this a little bit, but let's kind of flesh it out a little bit more. Is it normal to have irregular periods after birth? Yes, it is, and you've established that. But is there a time that we should expect them to go back to normal, and what indicators should we look for?
Good question. I would say if breastfeeding has been completed, I would say after that, I would usually wait 2 or 3 months maybe to see if my patient has gotten back into their regular cycle. And if they haven't, and they're not breastfeeding anymore, then I would recommend that they see their doctor, their family doctor or their OB, to get a bit of workup to figure out why they're still irregular, or why they haven't come back. I have some patients where they don't come back, and we have to look into it and work it up and figure out why that's happening.
Great. So I encourage anyone who's watching today to ask questions and put your questions in the chat, and we will answer them. If you maybe missed this entire live, you have to jump off. That's okay. This will be saved, and it will be also reshared with Dr. Hawkins as well. If you want to follow Dr. Hawkins, click that little arrow above my head, and you can give both Dr. Hawkins and Treehouse a like as well, and follow. Before today's session, we also asked individuals through our Instagram if they had any questions. So we did have some questions that were sent to us. So we're going to walk through those as well. But I do see that there is a viewer here that asked a question. What should I do if I am experiencing pain when inserting a tampon postpartum? So after that 6 weeks time, I presume, is what you're asking.
That's a great question. And it is a common problem. And it can happen for one of two reasons. It could be painful to insert a tampon because you've had a vaginal delivery and there have been some stitches and some healing in the vagina. And certainly that could cause some pain when trying to insert a tampon. The other reason it could happen is because in the postpartum period, our estrogen, which is our female hormone that creates lubrication in the vagina, is extremely low, and the vagina can be very, very dry. And so if there's less lubrication there, it could be more painful to put a tampon in. I think that it's common, so if someone's experiencing that, they should know they're not alone. One thing that a person could try is using a little bit of lube, like KY jelly, or even getting some examining lube that we have in the office here to borrow from the office and use to put on the tampon to put in. But certainly don't hesitate to see your doctor, either your family doctor or your midwife or OB provider, and ask them to examine you if you're okay with it, have a look and try to figure out why it's hurting. Something else I sometimes do in the office too is I ask a patient to bring their tampon in with them, and we do it together in the office because, you know, things have changed down there. They feel different. Maybe there's an area of pain that I can help navigate. So that can be really helpful too. Yeah, but don't hesitate to ask about it. It is a problem that can happen.
And just be open with your care provider about that. They're there to help, right?
Absolutely.
What is too much bleeding postpartum, and when should I be concerned?
That's a really good question. We usually kind of recommend to people that too much bleeding is if you're completely soaking a maxi pad once per hour, and that's happening over the course of 2 hours. So by that, I mean, if you're wearing a maxi pad and you can't see any white anymore or hardly any white, it's entirely red, then that happens over the course of 1 hour. We consider that quite heavy bleeding, and we would recommend that you go to the emergency department to get checked out. Another thing that you should watch for is a large amount of clots. So if you're passing a large volume of clots, say into the toilet, then you should go in and get checked.
Okay. Yeah, very important.
Yeah.
And just to act quickly as well.
For sure. Absolutely.
Some of the questions that came in over the last few days, we'll jump into those, and they deal with contraception. Can I take birth control after giving birth? And if so, how long after giving birth should I go back on the pill?
That's a great question. Yeah, and usually we kind of chat with patients about that at their, for me, at the 6-week postpartum visit. And go through all the different options for birth control. So keeping in mind that not only do we have the pill available, but we have many other methods of birth control, which we could talk about as well. In terms of postpartum birth control pill, there are 2 types of pills. One type of birth control pill, which you may know as kind of the standard one, has both female hormones in it, the estrogen and the progesterone, and the other type has progesterone only. There is a little bit of a difference between them in terms of what we recommend for what to take postpartum. So the pill that has both the estrogen and the progesterone could potentially decrease your breast milk supply if breastfeeding is not well established and if you're motivated to breastfeed or you want to continue breastfeeding. So sometimes, just depending on your situation, we may suggest the progesterone only pill, which is also called the mini pill. And generally at the 6-week postpartum mark, both types of birth control pills are safe to start. But it is a conversation that really depends on your situation, your goals, and also your medical history as well, because there are certain medical problems that make taking birth control not safe. So it's important to chat with your doctor about all of those things when you're ready.
Great.
Yeah.
I guess we spoke about a concerned postpartum period, which was with heavy bleeding and clots as well. But that was one of the questions one of our viewers sent us a couple of days ago, was when should I really be concerned about a postpartum period? Anything we should be concerned of maybe after the 6-week mark as well, or do you feel comfortable with that response that you gave?
Yeah, you know, we use the same rule, I would say, quote unquote, if you're bleeding so heavily that you're soaking a pad an hour, or if you're bleeding so heavily that you're flooding onto your clothes, or it's really affecting your ability to do your normal activities, or if you ever feel lightheaded or unwell because of heavy bleeding, then that's a reason to seek care. And so that applies to all of your periods, whether it's just immediately postpartum or not.
Okay.
And so that's the heaviness piece. The length piece, I would say most periods last about 7 days. If they're going more than 10 to 14 days, that's when I want you to be calling your provider and talking about how long they are and whether there's any cause of that.
Yeah. Okay. One viewer asks, she says, I have heard some women experience larger blood loss when they breastfeed. Is this normal? Is it common? If so, again, how do I know if I'm bleeding too much?
Yeah, good question.
Interesting question.
Yeah, so postpartum, when we deliver, the uterus slowly starts shrinking down from that term, what we call full term size or 9-month size uterus, all the way down over the course of the 6 weeks to back to a normal size uterus. And a normal uterus with no fibroids in it or anything is about the size of a fist. It's pretty small. So all the way from accommodating a baby down to that amount has to happen. And that happens through a hormone called oxytocin, which causes the uterus to contract down. Every time the baby latches on our breast, it releases oxytocin and causes the uterus to cramp. So every time we breastfeed, you could notice more bleeding because the uterus actually cramps during the breastfeeding and some more blood could come out at that time.
Okay.
So it's not necessarily that it's causing heavy bleeding, but it's causing the uterus to cramp and then some clots and blood that were sitting in there can come out. So that's actually very, very common. And again, if it's super heavy, of course, we want to see you into the emerge, please, and get checked out.
Yeah, absolutely. Very, very interesting.
And also, I'll just add to that too, it
yes,
can cause
please.
really bad cramps. So
Okay.
sometimes we notice those what we call after pains or those cramps after the delivery can be really terrible and they can be worse while breastfeeding if the patient is breastfeeding. Yeah.
What kind of recommendations would you give to folks who might experience these after pains? How can they help themselves at home
Yeah,
or wherever they're breastfeeding?
Yeah, for sure. Comfort measures wise, just being in a comfortable position, having a hot pack or something warm to put on the tummy or on the low back can be so helpful.
Yeah.
And medication wise, if there's no allergies and it's safe for that person, we often recommend Tylenol and Advil postpartum.
Okay.
And even helping with the after pains, that can really help, particularly Advil, which is in that class of medications of anti-inflammatories, is really good for uterus cramps. So keeping the Advil at hand, and if you're having those terrible cramps, taking it before breastfeeding can be really helpful.
Absolutely. Perfect. Thank you. For folks just joining us again, please remember that you can feel free to ask as many questions as you'd like. If this is something that you'd like to follow us along, you are absolutely able to share this video and watch it later as well. Just ensure that you follow Dr. Lesley Hawkins as well as Treehouse. And you can do that by clicking that little arrow above my head. So we have a few minutes left. I have one other question that is coming in, and it was, if I experience a tear during my birth, how will that affect me postpartum, and maybe that impacts their period or their blood loss during those first 6 weeks?
Yeah, good question. Usually the actual tear itself won't affect the postpartum bleeding very much. Certainly it will affect pain and recovery and how you're feeling, but usually not the amount of bleeding. Most tears that happen in the vagina. They're very, very common. And usually your healthcare provider would place some stitches in that area right after birth, and those usually melt away by themselves or dissolve on their own. Actually, bleeding from that area is less common. You may have a tiny bit of bleeding from the actual tear, but the majority of your bleeding will be coming from your uterus. Yeah, so it shouldn't directly affect your bleeding postpartum.
Okay.
Yeah, certainly, of course, though, it's uncomfortable. And again, those basic pain medications like Tylenol and Advil are really helpful, as well as doing sitz baths, so sitting in kind of a warm bath, which you could either do in your bathtub or on top of the toilet seat. They sell plastic sitz baths, at pharmacies, and that really helps to help the tear heal as well.
Yeah. Cramps, another question. Will my cramps heighten after birth? So I'm assuming this is once the period
Comes back.
comes back.
Yeah, there's no good evidence to say that periods necessarily change after we've had a baby. But I think anecdotally, just talking to patients and friends and so on, I think a lot of us experience some change in our periods after we've had a baby. That's unpredictable. Yeah, cramps could be worse or better. Periods could be lighter or heavier. It's very unpredictable. Yeah.
Well, thank you, Dr. Hawkins. I think for the last few minutes of our call, I think we've gone through a lot of different questions
Mm.
and different topics. We've covered breastfeeding, we've covered periods, specifically, we've talked a little bit about contraception as well, and you've given us a really great overview as to what we might expect if we're maybe pregnant right now and about to deliver and what that might look like for us, or maybe we're in that circumstance at the moment. Before we go, I wanted to ask you if you wanted to share any specific takeaways for our viewers around this topic.
Sure. I would just summarize by saying that everyone's experience is different and it
Yeah.
is hard to predict, and that irregular periods postpartum are very common, and you're certainly not alone. And the contributing factors can be breastfeeding. So if you ever have a concern, of course, check in with your doctor about that. And and then in that postpartum period, know that if you're having heavy bleeding or any concerns, that you should go in and get checked out for sure. But that postpartum 6 weeks of bleeding could be variable. It could be up and down a little bit. And remember to only use pads during that period of time.
Fantastic. Well, thank you. Some of our viewers are complimenting you on this very informative information that you've just
My
provided us.
pleasure.
Thank you for taking the time during this lunch hour here on the East Coast to talk with me and to provide such fantastic, valuable information and knowledge. I'm sure everyone is better informed now. And again, if you'd like to see more content like this and other topics, please reach out to us and we'll make it happen. Thank you again, and we wish you a wonderful rest of your day. And again, thank you, Dr. Hawkins.
Absolutely. Yeah, no problem. Good to see you.
Okay, bye-bye. Bye,
Bye.
everyone.